Welcome back, everybody, to Leading Experts. I'm your host, Grayson Foster. Joining me on the show today is Dr. Alan Nazeri, and we've been discussing general and cosmetic dentistry. Dr. Nazeri, how long do veneers last, generally speaking?
Veneers tend to last a very long time based on how patients take care of their teeth and their smiles and so forth. And obviously, what type of a lab is used, what type of a bonding material is used, and so forth. But there are long-term type of a restoration.
Are there any type of contraindications with veneers at all?
You know, veneers can be contraindicated in people who have extremely difficult bite. There are grinders and so forth. So if the bite is managed correctly, we can do veneers on those individuals. Otherwise, they tend to fail.
Okay.
By the way, you have a beautiful smile.
Oh, thank you. They're all mine.
Oh, I love them. I love to look at beautiful set of teeth. So.
Thank you. What about the cost? Should people be afraid of the cost? Is it too expensive? I mean, what's your opinion?
That's a great question. You know, the cost varies from one dentist to the other. Really, the cost that makes up for the veneers are the expertise of the dentist and the laboratory cost.
Yes.
And the laboratory is a big portion of it, okay? There are many labs that provide veneers, and there are only a few dental labs in this country that provide really exceptional artistry of making veneers. So it depends on who you go to and so forth, but generally, you know, it's a very small cost compared to what it does for patients.
Okay. Do you offer any kind of guarantee once you do someone's smile makeover?
Absolutely. You know, in our practice, we guarantee all of our veneers. If there's something that the patients don't like and we have to make revisions or redo something, we will do that free of charge up to about 12 months. And then there are some guarantees that come with the laboratory as far as if they're fractured and so forth. And patients can call our office and we'll can go over the details with them.
I want to take a look at a couple more of your patients here. And this lady, she had a full mouth reconstruction as well, right?
That's correct. When she came to me, she wasn't smiling much because she wasn't very happy with what the teeth looked like. So, you know, I think we have a shot of the retracted photos of her. Yeah, you know, she wasn't happy. Old restorations, old crowns, a lot of crowdings and so forth present.
Yeah.
So basically, she came to us and we did a full mouth reconstruction, corrected her bite without the use of braces or orthodontia or anything like that. And I think this was all accomplished really in about 6 weeks' time,
and now
start
she's
to
smiling.
finish.
There she
Absolutely,
is.
she's smiling very big now.
Her teeth look beautiful. I mean, that's an incredible job.
Thank you very much.
Now, I think this is our last patient of the day we're going to take a look at. What did she want to come and see you for? Again,
Linda came to me, again, aesthetic was an issue, but also her bite was an issue. So you can see, again, she has really a deep bite. And when you have cases like this, generally what happens is that the teeth on the lower jaw are grinded down severely.
Right.
So if we go to the next picture, I can show you how we finished her upper teeth while she was in an orthotic on the lower to make the muscles comfortable and so forth to a new bite. And then we redid her bite on the bottom and we ended up with a fairly nice case.
Wow.
And we were able to protect those teeth that were grinded down and so forth.
Now, I noticed that you took all the gold, what are those, gold crowns?
Gold crowns out, yes, yes. We took them all out because, you know, she just didn't like the aesthetics of it and so forth, but we had to redo her bite in order to be able to do something about those teeth on the bottom.
Wow, and a beautiful smile. And it broadened her face.
That's right. I mean, I think it took years off of her face, really. So that's, again, why I'm saying I think we own the face. So
yeah, it looks fantastic.
Right.
Dr. Nazeri, I know you want to give the folks watching today a special offer. So what is that?
Well, they're welcome to come into our office if they're considering a tooth to be extracted, whether they're considering veneers. Again, we are a general dentistry office. We do dentures, partials, all range of general dentistry. So they're welcome to come in. We would provide them a complimentary consultation, and we will make sure they know all of their options, and financially they're aware of what everything will cost before they leave the office.
final question for you. Where should a patient start if they want to have a smile makeover or they need, you know, their mouth redone at all? What do you say?
I think the best thing is to, you know, ask around and find out, you know, who are some of the reputable dentists in town. Go talk to the dentist. You know, it's very important that the dentists have done a lot of these cases. In our practice, we provide, you know, a long list of our patients with their phone numbers that any new prospect patient can call them, ask them, and so forth. And, you know, it's really, my patients are really big advocate of our practice, and they're the ones who bring more patients to our practice. So
wonderful.
Yes.
Thanks for coming on the show today,
I
Dr.
appreciate
Nazeri.
it. Thank you so much.
Thanks for watching this edition of Leading Experts, everybody. We'll see you next time.